My name is Ajay Kumar. I'm Chief Clinical Officer for Hartford Healthcare. As we start, I want to go through some of the details regarding how many patients we are caring. I do want to start with acknowledgement that we are seeing a significant decline across the Hartford Healthcare acute numbers. We have 232 patients today, which is definitely a 20-30% decline from almost about 10 days ago. We have 6 patients in behavioral health, Bacchus Hospital. And Charlotte Hungerford, we have about 12 patients, which is lower than 15 yesterday. Hartford Hospital has 97 patients. Midstate Medical Center has 13 patients. St. Vincent has 68 patients. Hospital Center Connecticut has 31 patients. And Wyndham Hospital has 5 patients, total 232 patients. We're going to continue to see this decline, but I think Hartford Hospital and St. Vincent will continue to have some patients who would be with us through the summer as well, and the numbers, although will be lower. There's a few other important announcements. Mobile pop-ups testing site, Phillips Health Center in Northville, North End went live, and we had about 300 individuals got tested. We're really proud of the work we're doing for the community to be able to reach to the places where it's difficult to get the access to the test. And that work is, we are able to do that because of a lot of community support and partnership. Without a doubt, these things will not happen. And the mobile testing site, our teams will be able to erect at this time. We are looking into creating a possibility that how do we become the resource of the state as we think about reopening the state. We are looking into processes where we can expand our testing capabilities to the communities to get the system back and the businesses back online as soon as permitted by the state and as soon as it's safe to do so as well. So we're exploring all the options. We're working with several businesses to see how best we can optimize that. The good news is we've exceeded more than 1,000 patients, actually 1,056 patients who have recovered from Hartford Healthcare facilities and gone home. Really pleased to have that number outline here. We've talked about essential surgeries in past. We are continuing to our process of evaluation, making sure the right type of surgeries who've been deferred for some time come back to us for the patients who require care at this time, who are suffering at home and delaying the care for a variety of reasons. Our safety is going to be core principle. We want to make sure we remain safe during this time. We're going to use a checklist to make sure that every single area of our organization, every single procedural area, OR, our units, cardiac cath labs, EP labs, emergency room, we're auditing an entire system at the moment to make sure that we have the right precautions, right social distancing capabilities, right processes in place, right equipment in place, and right way of making sure the patients are being managed. In some places, we might have less number of patients actually who can get the care, but the care would be provided in a way which is the most safest way we can do at this time. Our teams of 70-something individuals are making sure that we look into every part of the organization and make sure that we follow the guidelines which we put together from our Quality and Patient Safety Division across Hartford Healthcare. We do continue to have a good supply of PPE. We have communicated several times, and we're going to continue to do so. That our colleagues have given a lot of feedback, and our policies are as good or better than CDC at the moment regarding how PPEs are deploying. We continue to have a wonderful supply chain department who's working really hard to make sure the pipeline remains open. The concerns are about N95. That's generally been the concern for us in past, and that's the only item which we have somewhat of a low supply, but we are good, well situated in other areas at this time. And we're looking into this. The PPE supply needs to be ready not for the next week or 2 weeks, but in almost a year. We're thinking about how we're going to sustain that excess amount of PPE requirement given this COVID pandemic for almost about a year or more at this time. Our telehealth and virtual health capabilities continue to evolve. We have had more than 1,000 visitations as of right now. Our behavioral health network especially is becoming a wonderful channel for supporting our community at this time. Individuals are reaching out for different type of counseling and advices at this time, given the tough times ahead of us and in the middle of right now. So we're really proud to have such a large behavioral health network across the Hartford Healthcare who's able to cater to the need of the community and support them as well. We're going to continue to explore to do as well as we can do within our capabilities to support our people within the society. With that, I have a distinct pleasure of having one of my colleagues, Sarah Lewis, joining us right now. She's a Vice President of Health Equity, Hartford Healthcare. Sarah is one of our finest member of the organization who joined recently, who really have positioned our Hartford Healthcare to focus on diversity and health equity, and we're so proud to have her in our team. Sarah, thank you.
Hey.
Good morning. Thank you, Ajay, and good morning, everyone. I just want to start by saying that I'm so grateful for the incredible work of our frontline colleagues across our system. They are doing an incredible job. Sorry, can you mute your lines if you're listening in? Would you mind muting your line if you're listening in? One moment.
Yeah.
Go ahead.
Okay. I want to start by saying thank you to all of my colleagues on the front line across our system, in all of our acute care facilities, and every single one of the places where we care for patients every day, and every single office where we do our work every single day. I know it's been a really rough year, and you've been stepping up and providing exceptional care and caring for one another in an incredible way. So whether you're working in environmental services, whether you're working at the bedside, whether you're working in one of our offices and supporting our personnel, just want to thank you for that. And I just want to acknowledge as well that we're in the midst of a time of collective loss, a time of collective trauma. And as of recently, we just passed 3,000 deaths across the state, and that's something that we need to figure out how to process together as a community and as a state going forward. In my work, at the lens that I look through, I look at health equity, and I look at how this loss that we're suffering, this trauma that we're experiencing, affects different populations. And as we've seen at a national level, there has been a disproportionate burden when it comes to the prevalence of COVID-19 infections among Black and Hispanic populations based on the data that we have right now. Nationally, we're seeing that the weighted distribution of deaths among Blacks is 18%, as compared to just 12% of the population overall, and among Hispanics, 26.9% as opposed to 16% of the population overall. Again, seeing that there's a higher percentage of hospitalization among Black Americans where we have the data, and in some places a vast disparity between the percentage of the population that's Black and the percentage of the population that's infected and hospitalized with COVID-19. And here in Connecticut, we're still collecting data. We are seeing the state report on a daily basis, the rate of infection among different demographic groups, and also the death rate. And those crude rates now are, again, sort of tracking with the national level, seeing that the rate of infection among Black members of our state are much higher than the rest of the population. The same thing with Hispanic members of the population, and that the crude death rates for Blacks are highest in the state of Connecticut than for any other group, where we have the data. So for us, from the health equity perspective, unfortunately, the only thing new here really is the virus, because there are some underlying systemic issues that create the conditions for these numbers to emerge, and could have predicted essentially that because of inadequate housing or inadequate access to food and the way that our society is arranged, that this disease was going to hit certain communities harder. And so the way that we're talking about it internally is how we can respond, and I think that everybody across the state is thinking about how they can respond as well, because if there's one thing that this virus has shown us, it's that our health and well-being is interconnected. So we're looking at it from an access point of view. As you all know, we have our 24/7 hotline that's available through our clinical command center, available every day for guidance, counseling, and expertise to talk to our exceptional providers who staff that line all day. And we're also looking at testing, and we all know that testing is the roadmap forward in order for us to safely reemerge, to safely interact with one another, to safely resume our lives, and do so in a way that we don't end up infecting others or catching the disease ourselves. And so we're looking at ways to bring testing into communities in ways we haven't before. And I want to again commend my colleagues for the great work that they're doing to figure out how we can do that. Over the last few weeks, we've brought testing into different communities. We're going back today to the Open Hearth facility in Hartford to test the residents and staff of that location. We're looking at additional homeless or populations and how we can test them in different parts of the region. We have some coming up next week. We're looking at group homes. We'll be testing at 2 different group homes this coming Friday, and looking at some additional community sites in other outside of Hartford for next week and the weeks beyond. I want to commend my teams for doing that outreach, connecting with our community partners who are on the front lines themselves every single day to find out where and how we can show up with the testing that people need. And I just want to say as well that we are open. I know a lot of people have stayed away from the emergency room because of fear of COVID-19, but as I know Dr. Kumar has said in this forum many times, please don't stay home if you're experiencing an emergency right now. Come to us, seek medical care. The added tragedy of losing lives because people are afraid to come to the hospital for care, whether it's COVID related or not, is just something that I don't think we should have to suffer through. And with that, I'll leave it there. Turn it back over to Ajay. Thank you.
Here for any questions. Sarah Lewis is here with us as well to answer any questions. So anything you'd like to ask?
Hey, Brian Ditlake here with Box 61. Going back to Ms. Lewis, when it comes to health equity, this whole COVID-19 pandemic has really highlighted some of our racial and socioeconomic disparities when it comes to getting tested in healthcare. Can you go into more detail on how we're planning on getting more testing in these type of communities?
Yes. So we are ramping up our testing capacity, and in addition to using the Quest test access that we got that we announced a couple of weeks ago, and not only is that available through our drive-through sites, it's also available through this mobile testing process that I mentioned earlier. So we're actively going out into the community as often as we can. The goal is to do it every single day, and to bring testing to locations where people may not have a car, where people may be in a congregate living situation like a shelter for people experiencing homelessness, or a group home, or a skilled nursing facility. We're testing 2 skilled nursing facilities this coming Monday, and doing that across the state is the plan. So we're doing that every single day, learning as we go. This is a new capacity and sort of asset for our system. That
your hair looks so good this morning.
That I have to commend my colleagues for pivoting and figuring out how to do this in response to the disparities that we have seen. We know that testing is the way out of here, and we want to bring equity to the testing process. And that's why we're developing these mobile testing assets. Thank you.
And one more question. Have you seen any pushback from, these minority communities just because recent studies have said, especially in the South, and it might be the same here up north, a distrust for, medical attention in certain communities versus others?
That's a great question, and I think that overall, it's important that we, as providers, members of the public, our policymakers need to understand that there is a history of historical medical harm in this country, and that's not something that should be overlooked or discounted by any means. So personally, no, I have not heard that, but I think it's really important to understand that we will be moving forward at the speed of trust with our communities. We seek their counsel, we seek their input in terms of how we show up and who we show up with. So that's an important part of this process, and it will be going forward.
All right, thank you. I appreciate it. And my last question going towards Dr. Kumar. When it comes to everything that's going on with COVID-19, I know we're going to we expect to hear more about the effects with children later on in these briefings, probably Thursday or Friday. But if you can just go over what you know about, I guess, what we're seeing now when it comes to the Kawasaki disease-like symptoms in children, and just what you've been hearing so far.
Yeah, so this is this is a disease, now it has names, PIMS, Pediatric Inflammatory Multisystem Syndrome. And basically what it does is that it creates inflammation in the arteries, the vessels, and especially younger children, preteens and younger. And we've seen that in some areas, especially in New York, most of the case reports come out in some other parts of the country as well. And it's an inflammatory disorder which requires support from medical attention point of view. It's a interesting disease. We're learning kind of new about this. There's a lot of information will come out over the time. We've seen the similar type of behavior in the Kawasaki type syndrome, which is a well-known entity, especially affecting the children, where we have this vessels being inflamed and the blood supply not being able to reach in the right places, and sometimes the aneurysms form in the thin walls of the blood vessels, which leads to multi-organ failure type situation. We're seeing this one with the inflammation, which is widespread as well. Now, in Hartford Healthcare, we don't have any cases of this type of illness at this time. And we will hear more about this over the next week, and we'll share the information as best we can. But in Hartford Healthcare, we've not seen any of the cases.
Gotcha. And my last follow-up to that, just going forward, it may be too early to ask this, but do we expect this to be a delay in schools reopening, or is it too early to ask that right now?
I think when you talk about reopening, I want to make sure that you're talking about the opening of economy or opening of healthcare system in essential surgeries and other areas. So in the second part, the healthcare system, at least Hartford Healthcare, is well prepared with the safety standards and all the things I just talked about, that we are making sure that we create the environment for our patients who are going to come for essential surgeries. They've been differing for a while, or seeking, delaying some attention through our emergency rooms and all that. We create a safer environment for them with all the things we're doing at the moment of deep cleaning of every single area, the checklist, audits, and things like that. So from that perspective, we're prepared. We never actually stopped completely because the urgent emergent surgeries were happening. But as you know, in those COVID times in March and April, the trauma activations and other things had gone down quite a bit because not a whole lot of people are traveling. But we're going to see that. We're seeing that increase happening at this time as people start to travel and all that. In regards to the economy being open, that depends on several things. And I like to believe the state is doing a really good job in that part here. The governor's team is really leading a good effort in that, being thoughtful about this. One, increasing testing capability across the system, which Hartford Healthcare is leading the effort in that part here. The second, we are making sure that the contact tracing and the DPH resources are appropriately utilized in that sense here. The third one, obviously, the not easing on physical distance policy or social distancing policy completely. It's a phased approach. It's a cautious approach. It's seeing the approach where we go a little loose and we'll see how it happens. And if there is some activation of infection we react to that very quickly. So it's the right approach to do so. I think with the children thing, I do not think at this time we will be concerned about opening in some sectors. But when we talk about the school opening, which is not happening in Connecticut, but if we talk about the opening where the kids can congregate, that is concerning because, one, we don't understand about this new illness all that well. Number two, we already know the children are asymptomatic carrier by and large. And the challenge is that with easing out those restrictions, you can actually infect the vulnerable population. Our prime job at this time of society to protect the most vulnerable. The people actually who do not have the access to health care, the folks actually who are at high risk given the disease, how it affects you. And that should be our prime responsibility, to reduce the mortality, reduce the suffering. And to do so, we have to be cautious about that. So for children's resurgence of this disease, which is happening right now, would not affect us unless we decide to do something different, which is easing our social distancing policies, allowing kids to go back to school, having gatherings with children being there, opening restaurants where the kids can come in a place where there's a lack of social distancing. And the way I think about it is, I think the state has done a good job of really being careful and cautious about that. That's the right thing to do.
Gotcha. Thank you all for speaking with us. We appreciate it.
Thank you.
Dr. Kumar, sticking with the opening theme, obviously the state's economy opens next week with businesses and such. How concerning is it to you that in other areas around the country where there have been openings and there have been flare-ups, are you concerned of that possibly happening here?
So I'm very concerned, especially in the states actually who have not really followed the CDC's guidelines to the T. There's a lot of information which is missing here as well, because those states we don't know how much and how much testing is being done to begin with. So real prevalence is somewhat difficult to know in those areas. That's one of the challenges we've had across the United States as we've gone forward. It does concern me because if any of the states, neighboring states, or any of the states actually open up, the mobility factor of people to travel to different states, the families getting together or sneaking out and meeting the relatives and all that kind of stuff, there is a psychological impression we actually passing to the community that things are good and good to go, which is not the case here. So there is a concern here. I think the Connecticut, and I like to believe the governor is working with regional partners here right now, being in the same thinking around that gives me some comfort here, that we are thoughtful about our at least policies. So the other side of the equation is that the adoption of the policy, how well are we going to adhere to that? That's in the society. That's on us, how we react to that. And to a certain extent, that's where my concern is. I'm concerned about how we are going to see this perception of reopening, which is happening in different parts of the country, and how the people are going to react to that and start taking the measures lightly. And that would set us back. So the message should be that we need to continue social distancing. We need to be cautious. We do need to open the sector of economy where it's appropriate, with the right measures in place, right safety precautions in place. And I described to you earlier on in Hartford Healthcare, the amount of information, amount of focus we have on that part is incredible. Imagine 400 access sites, 7 hospitals, a large post-acute network, and I'm asking my teams to do audits in every single segment of the organization. It's a amazing task which a team's undertaking right now. Not just one shift, multiple shift, to make sure we remain as safe as possible. So that is the kind of intensity and focus we need from our leaders at this time, from our society at this time, from our businesses at this time, to be able to safely open. And that would be my message at the moment, is that to continue to follow social distancing, continue to pay attention to the deep cleaning, continue to pay attention to the norms we talked about, hand hygiene, not touching your face, not being in the vicinity of the most vulnerable population of our society.
Okay, thank you.
You're welcome. You did not invite Emily and Bridget today?
They're on.
They're on?
They're quiet today.
Okay, very good. Any other questions?
We have a question on Facebook. Do you know when and where you can get the antibody test without a doctor's order?
Yeah, you can actually get it done through Quest Labs. They're able to do so. Hartford Healthcare, we can get it done. I don't know whether you can get an antibody test without doctor's order at the moment. I have to confirm that part. But I encourage any members to call Hartford Healthcare physician offices, and they will request the test for you, and the Quest will be able to do some testing at this time.
Another question, did the number change of positive cases in mid-state today?
And now you got me here because I don't have paper in front of me. I think the numbers, thank you. Mid-state numbers have gone down, actually. It was higher yesterday, it's 13 today, so it's going down at this time. Thank you. All right, well, thank you very much.